Hello, we all of you. We from Group 13 and now we're to present about the implementation of first aid to employees in Petronas Chemical Fertiliser Company. Introduction. Workplace injuries are injuries that arise from and during employment. First aid is determined for the purpose for preserving life and minimizing the consequences of injuries and illness until help obtained from a medical practitioner or nurse. Actions that at the time of incident are done to prevent damage and complication and or to reduce pain before the arrival of health care personnel or to carry the injuries to health center. In fact, first aid is to give emergency care to injuries painting.
Okay, next I will proceed to problem statement and objective of this research. The problem statement of this research is fatal incident estimate the number of deaths at work as a result of incident sharply rising from year to year. Next, the lack of safety and health facilities at workplace. And the last is insufficient first aid causing injuries cannot be overcome and treated immediately. The objective of this study is to identify the lack of safety health practice at Petronas Chemical Fertiliser Company and to analyze the workers' level of awareness of first aid knowledge. Okay, next I will proceed to literature review. There are many of research we took as a reference materials from past year according to this research topic. So, one of them are, according to Bakrata on 2009, and education and training in first aid are important resources for saving life in emergencies. First aid is an act of humanity that displays a willingness to save life without prejudice and without complete respect for diversity. Next, the effectiveness of first aid safety and health program. Safety training will increase knowledge and reduce injuries in workplace. Each year, 2.3 million of people worldwide suffer from work-related or injuries, with more than 6,000 deaths while working every day, according to the International Labour Organization.
Capai show as many as 85% workers who is personal protective equipment were doing work in the fertilizer factory, where 16% not used were performing duties. Graph show the personal protective equipment worn by employees according to the order of the work in the fertilizer factory. Overhead protective gear are the most important in a steel mill. Thus, as many as 16 of the tools used were working. The percentage of workers who use gloves in the fertilizer factory were placed by 1.7, which is the least amount of equipment in the fertilizer factory.
Okay, I will continue with data analysis of the types worker accident in Petronas Chemical Fertiliser Company and the attitudes of employees towards learning first aid. The type of accident in Petronas is struck by object, inhalation, absorption and ingestion, falls, stricken against objects, oval ejections, caught in between object and others. The higher percentage of worker accident in workplace is struck by object. Accident in which the employee injured when bumped into object contribute 38%. This accident involved contact with fixed object involving machines, conveyors, and other moving equipment. The lack of facilities and awareness of first aid contributes to major accident risk and give highest negative impact to employees and employers. Most of employees are agree with giving first aid fair and impartial to victims, and they also agree that providing first aid was very good to reduce impact from accident happen.
Next, feeding and discussion. Today, work environments have a greater risk of injury and illness due to the nature of the work being carried out and the nature of the hazards. Especially at Petronas Chemical Fertiliser Company and recurring reminded medical treatment from the office. First aid preparation may have a beneficial effect on employees who can reduce the effect of an injury at the workplace on the subject of the incident. Tend to improve staff behavior in order to be more aware of the possibility of hazard and to be informed that an injury can occur at any moment. It also suggests that first aid preparation will help to address the motivational issue of the direct personal context of employees with negative outcome.
In conclusion, the implementing a first aid program will increase knowledge and reduce the impact of accident on employees at Petronas Fertiliser Company. Next, employee safety and health practices show unsatisfactory as there are workers who do not use personal protective equipment. That show the lack of safety and health practice of employees while doing their job. The level of employee awareness is very important to first aid knowledge. This can be evidenced by the high percentage of employee consent in learning during first aid programs. The workers must have a high attitude in learning first aid program. The first aid program is very important program and benefit to employees and employers to reduce injuries and increase the productivity.